Good afternoon, everyone. Welcome to the Montgomery County briefing. Today is March 24th. We are live from the Emergency Management Operations Center in Montgomery County. First thing I would like to do is to thank all of our partners and residents from across the county for listening to the guidance and practicing that in their own lives. I'd especially like to thank those that are on the front lines, our healthcare workers, our public health department, all the essential workers in both the private and public sectors. I'd like to thank law enforcement, our correction officers, our deputies, those at social services, and many others who are continuing to provide the service to those who need the service or are our most vulnerable. As of noon today, we now have our 4th confirmed case of COVID-19. We have over 100 people in quarantine. But most important, this is our first case where there is no clear connection to another case. So what does this mean? This means it was likely community spread. No one is immune, and you might have it and not display symptoms, and you could pass it to someone else. It is here. The days of isolating cases, although we will continue to do that, and looking for those specific connections solely is over. We need to emphasize to the folks in the region that it is here and we need to take it seriously. We've heard a lot of information about being short on supplies and things of that nature, similar to other areas. The good news right now, in the short term, as it relates to supplies, masks, gowns, things of that nature, we're doing okay. We've been making deliveries across the county to those in need. I'd like to offer a special thank you to Rick Sager and Jeff Kaiser and his team in the Emergency Management Office for taking in those calls and making sure the supplies get to those who need them. And I would emphasize that folks that are in need, to make sure they call our Emergency Management Office if you're at a nursing facility, hospital, things of that nature. But we need to keep in mind that this is just a short-term view. The governor said today that, yes, it's rapidly changing and our apex is still 14 to 21 days away and could be even further for us in Montgomery County. So this is not going away, folks, anytime soon. Likely we will have to extend our state of emergency that is up at the end of the month. But we are going to continue to serve as a conduit for information and resources from the state and federal government. We've been coordinating with our healthcare facilities, schools, businesses, nonprofit partners, and doing our best to get the most accurate information out to county residents. Whether it's whether or not a business can stay open or other issues that our community is facing, our team is doing a great job of trying to get the accurate information as it changes day by day to the appropriate sources. But please be sure to follow the following sources. Obviously your local media, official county and municipal social media accounts, our county website, as well as hyperreach messages. We've sent out a hyperreach to across the county earlier in the week, or last week, emphasizing our senior citizens. If you have not signed up for hyperreach messages, please do so. We are going to post a link on our social media after, so when we have direct messages that need to get out to all the landlines as well as cell phones that sign up, if you're not on that, you are not going to get the message if you do not have a landline. So we encourage you to sign up for that, and we will post a link on our website. But that's our situation. We have social spread right now. We're doing everything we can, but what else can you do? You need to follow the guidance from your federal, state, and local governments. And most importantly right now, Montgomery County is one of the oldest counties in the state. And we all know that this virus hits those that are elderly with underlying conditions the hardest. So please, please, be mindful of our senior citizens. Check in on them. make sure that they are isolating themselves, they are quarantining themselves, and they are eliminating contact. Just because someone has not tested positive does not mean that they should be in contact with our senior citizens wherever possible. But ultimately, I think we all need to hang in there. We're tough people, we're resilient people in Montgomery County. We've been through tough times before, and just like in the past, we will come out the other side stronger together. We will take a few questions for everyone that's tuned in, and thank you for doing so, at the end of the broadcast. But at this point, I'd like to introduce Sarah and Jessica from our Public Health Department and thank them for everything they've been doing and their team. They've been working long hours, day after day, with no end in sight, and we appreciate what you're doing. And we'll get an update from them and take some questions at the end. So Sarah?
Thank you. As the county executive said, for most of you that know me, I'm Sarah Barenko. I'm the Director of Public Health here for Montgomery County. The executive and I have been working on this epidemic since the beginning of February. Actually, Super Bowl Sunday was our first call with the state. In saying that, we have been very prepared for what is happening. And I find myself very fortunate when we say we have 4 cases, that we only have 4 cases. Because we have been very prepared to protect our residents and our citizens in Montgomery County from the fast spread of the COVID-19 virus. When I look at this epidemic, I'm looking at the logic behind it. We're looking at the statistics, we're looking at the numbers, we're looking at the concrete evidence that we have in order to control and eliminate the further spread of this virus. The work we are doing to keep people safe is preventing the spread. We have placed folks under quarantine, and Jessica will talk a little bit about the difference between what is quarantine and what is isolation. The executive made a decision along with our department to shut down the county. We've asked that private businesses in the county also follow those same precautions, and then with the governor's mandate, we know that that has happened rather quickly. We know that in Montgomery County, our patients are those that are 1 case at a time. So for us, we are very different in Montgomery County than some of the other larger municipalities. We are fortunate that we are seeing 1 case at a time. We don't have a cluster of folks in a nursing home, or we don't have a cluster of folks in one central location in the community. They are sporadic, which means that our folks are listening, and I beg of you today to continue to listen to protect our senior citizens. Most of you are probably wondering where these folks are located and what are some of the demographics. We're not at liberty to talk about the demographics of our folks, but I can tell you that 2 of the individuals that we have that are positive have been in their homes and have not left their homes, and the other 2 individuals are in a state where they are requiring medical care. So they are not in the general population and they are not in our community. So we have taken action to make sure that those who are positive have no contact with the general population in our community. Statistically, we are doing well when we look at other counties who are of our size. In saying that, it's because of the fact that our cases are not spreading as rapidly as they are in some other counties. And that goes to the work that we have been doing with our sheriff's department, our city police officers, our folks here in the county, as well as the support we are getting from the county executive's office and some of the mayors and other municipal city and village officials. So we are continuing to take field phone calls every day from the community, from residents, and we are here to answer questions and to dispel a lot of the myths. We will often get questions at our office about the rates of infection, where people live, and we are doing our best every day. My staff is answering about 100 to 125 phone calls each and every day. We are working Saturdays and Sundays and have staff on 2nd and 3rd shift answering phone calls that we are fielding from dispatch. So I can assure you we have not turned away anybody that has called our office asking for questions, and we are working diligently to make sure that that continues. With saying that, I'll turn it over to Jessica Murata, our Assistant Public Health Director, to answer some of the clinical questions.
Thank you, Sarah. Thank you, Matt, and thank you, everyone out there. We first want to preface that the situation and guidance surrounding COVID-19 is ever changing. Please know our team at Public Health is working 24/7 and doing our very best to support and guide you through this uncertain time. Currently, as Matt said, we have 4 lab-confirmed cases in our county. Anyone who is identified as a close contact for those first 3 cases has been notified. We're currently working very diligently to identify close contacts for our 4th case that we just received at noon today. In addition, we have approximately 100 individuals on public health issued quarantine. Those placed on quarantine are done so for the following reasons. Either you have been identified as a close contact to a positive case, you have recently traveled in the last 14 days to a country that has sustained widespread transmission of COVID-19, or you have been tested for COVID-19. Being on a public health issued quarantine requires you to remain in your home and be monitored for 14 full days. The reason for this is to reduce the risk of possible transmission in our community. We ask that if you are not on a public health issued quarantine, that you refrain, please, from using the word quarantine to describe your current status. This is an effort to lessen confusion and uncertainty for those around you. First responders, law enforcement, home health service providers who may need to enter homes have a very different protocol for an individual who is on public health issued quarantine. So if you are not being monitored by us at Public Health, please try to use phrases such as social distancing or self-isolation to describe your status. Another concerning issue we have right now is the availability of testing in our community. The testing situation as of now in this moment is being prioritized due to the lack of kits. Priority is for those who are very ill and require hospitalization currently, as well as for those healthcare providers who are on the front lines doing everything they can to care for those who are sick. Although our county lab confirmed cases are low in comparison to other areas, I do caution you not to underestimate this virus and its presence in our community. It is in our community now, and we need to do everything we can to keep it from spreading and overwhelming our healthcare system. We do appreciate everyone's efforts to try and minimize the impact of this virus. So, if you can, I implore you, as Matt and Sarah did, please stay home. If you are sick and need medical care, call your doctor for guidance. And certainly, if at any point you're having a medical emergency, please call 911. The things we do right now, at this moment, are going to determine where we are as a community in the next couple of weeks. Thank you.
And just one final note, I just want to stress the fact that we are containing the spread of this virus, and that is our main focus at this point. Data and surveillance is what is driving that, so when we find areas where we have individuals who have high-risk exposures, or we have folks that are in a place where we have groups in different density areas of quarantine, we are working very diligently on containment. And I think for us, that is the number one thing that is going to prevent the spread of this illness. Some of the questions you may be asking is, well, our numbers are so low because we're not testing people. And that is the farthest thing from the truth. A number of folks have been tested. We would not have the number of quarantines that we have in the county if folks were not being tested. So I would like to dispel that myth. When this started 2 weeks ago, we had a number of test kits available to us, but unfortunately, because of the high usage of those at the beginning of this several weeks ago, those test kits were used. So therefore, we know that testing produces higher numbers, but we also know that we have tested people, and we've also gotten 4 positives from those tests. So again, it's not that tests are not given or people were not tested, it's that those tests were given at the beginning of all of this, and now that we don't have them, we don't have the capacity as we did 2 weeks ago to produce the number of tested patients as we did.
And a few things I'd just like to reemphasize. This is a briefing that is focused on Montgomery County, our community, our neighbors, the people that we feel are the most vulnerable. There's certain levels of this that are outside of our hands, and you see that in the state and federal government every day with the briefings as they try to bring in more resources and find solutions to very complex problems such as more tests, which we desperately need, more supplies, which we really need, but also some of the new things that are being spoken about, and now you're starting to hear about economic initiatives to try to help us get out of this. And what I'd like to emphasize to people is that where we need to focus right now is that we do not underestimate, because of the fact that we only have 4 cases, that it isn't in this community like it is in others. It is here. And we need to be mindful of that, especially with our seniors. And I'm going to emphasize that again. We have one of the oldest counties in the state. This is our mothers, this is our grandmothers, this is our aunties, our nanas, our papas. We need to make sure that we're checking in on them, and when someone says that they're going to frequently visit someone who is 60 plus, 70 plus years old with underlying health conditions, we need the community to step up and say, no, that is not okay right now. I will make arrangements for you to go get those groceries, or for me to go get those groceries for you, instead of going to the grocery store, wherever possible. But also caution people that it's not going to be perfect. You just got to do the best you can. So for us here in Montgomery County, we're working, we're stable. Operations are continuing. The work of the Public Health Office is going to continue. We're going to bring you regular updates in a few days or next week as we see fit. But I'll just remind people that this is going to change quickly, and we've been blown away with the amount of information, misinformation, and rumors. If I had $1 for every text message I've received that I heard the rumor is this, and 99 out of 100 times it is not true. Stick with your trusted sources locally if you're looking for local information. That's the county website, that's your county social media, that's your hyperreach messages, that's our sheriff's office, our emergency management office. Stick with the trusted sources. And we're going to continue to plug on, we're going to continue to work, heed the advice. There'll be a time to discuss how the economy is going to move forward, how does the federal package, what does that mean for us, what we can do locally to provide revolving loan funds for businesses. I can tell you, we've been on the phone with a great majority of businesses in the county that are worried about closing, and we're going to continue to do that. But we're going to wrap up here and take a few questions.
What can the public expect to change when we get more near the peak of the situation? Are there any potential lockdowns or any other changes they could expect?
Well, I'll just speak generally. I don't think we're going to see a whole lot more as far as lockdowns. I think the message is going to be very consistent moving forward. If you do not have to leave for any absolute necessity, don't. And keep special care of our senior citizens. But as far as I've seen from the governor, he's now starting to shift his thinking on how to re-engage the workforce and get things moving. But you know, if you guys would like to take a shot at that, I don't see any big changes other than what we've seen right now.
Yeah, and I don't think we're going to. I think that it's pretty clear with the governor shutting down the state and saying only 100% of non-essential workforce. I think it's pretty clear. One of the things that we were talking about this morning was with the summer months coming up, what that's going to look like for people traveling in and out of our county and coming from downstate, upstate, and that is actually one of the concerns that I have, and I've been very vocal about that. We know that things tend to hit Montgomery County when they come up from downstate or they come down from the northern part of the state, and I'm just cautioning folks that if we know there are places where folks are using Montgomery County for summer recreation, summer homes, that is something we are going to have to take a look at and how that is going to impact us. With that being said, we've heard a lot of people criticizing people for being outside or being in their front yards, or they see somebody walking their dog. We're not saying that people have to lock themselves in the house and never step out the front door. If you have a yard where you can plant flowers and you can garden and you are alone, those are things that are acceptable. People need to be out of their houses as well, enjoying those things. We're just asking you to think about the social distancing piece and to make logical decisions and not react off of emotion. When your neighbor who is 4 houses down is yelling down the street, "Hey, how are you?" That's okay. We want people to be able to see each other and have conversations, but we just have to make sure we're doing it in a way that makes sense. I'm very happy when I open social media and I see that there's children in their driveways making chalk rainbows in the driveway. I think we have to encourage our children and our families to do things that are normal and are stabilizing for them, because these are high emotional times. And it is okay to walk your dog down the street. Stay away from the neighbors, but you can take your dog outside or plant flowers. I hope most of you yesterday were outside clearing snow like we were in our neighborhood. But again, we took care of our neighbors. We see our elderly neighbors who can't get down their front steps to get the mail or to take out their own garbage. It's clearing the sidewalks for them and making sure they're okay.
And I think it's safe to say that everyone act as though you have it and practice common sense.
Right.
Do not let the
Fear.
fear of the moment and the heat of the moment blind you to common sense. And just one more point to the question. The governor said today 14 to 21 days. And that's what we understand, okay, New York State, big state, classified 14 to 21 days. That does not mean that in Montgomery County, that could not be a few days or maybe a week behind. But the bottom line is, we don't know. And as we move forward, we're going to continue to provide the most up-to-date information as we can. But what we know right now is that we are in a period of where there is going to be some community spread, likely. And we need to all act as if, it's here. And how that trajectory goes, we don't know. Could be anywhere from 14 to 21 days, could be 28 days. But, we're going to have to take it one step at a time.
And I think for me, and I've been telling everybody, we're making decisions based on logic and what makes sense, and not those emotional responses and those emotional reactions. Because as Matt said, I think that's where a lot of the rumors and the false information is coming from, is people's emotional reactions. And so Jessica and I and our nurses are really looking at what makes logical sense. And I will tell you, across the counties, I will be very proud to say that I have the best nursing staff in any public health department, and I would challenge anybody. I have an OR nurse, I have an ICU nurse, I have an elder home care nurse on my staff, and that makes an amazing team of nurses across the gamut to really be able to make good clinical decisions and to make good level-headed sound decisions. And I have the best county executive in New York State, and I'm not saying that just because he's sitting next to me, but he assists us in making those sound, safe decisions. Our sheriff was our former emergency management officer. Our current emergency management director has years of experience in emergency services and as a paramedic in EMT and emergency medical services. So when I sit here and say I have the best team in New York State, I would put that against any other county. So.
But I think a lot of that has to do, thank you. I think a lot of that has to do that Montgomery County has been through a lot over the years. And we know how to get through tough times, and this time is going to be no different. Morgan, do we have any more questions?
How many of the quarantine people have been tested? And do you know how many tests have been administered?
Yeah, certainly. So as I discussed earlier, there's a variety of reasons why someone is on quarantine, and certainly being tested is one of them. So I would say about right now, we have about 50 people that have been tested, and we are still awaiting some of those results. And a lot of the confusion had occurred when the state rolled out initially, when testing happened. Anybody who needed to be tested needed approval through the local health department. So we were able to really manage that very well. Then there was a little bit change in tides and people were getting tested at various sites. So we are being very diligent in locating all of those tests, and we're following those, and we are ensuring that anybody who was tested are getting those results as soon as we get them.
So folks that went to other facilities outside of Montgomery County, so there were hospitals in Albany, clinics in Schenectady, other hospitals around the area that were giving out tests in the drive-by testing. And because those folks were not monitored through the health department, we don't have all of those folks who were tested. So that's why when this all started, it was really, really important that people maintained contact with the local health department so that we could track for accuracy. But as Jessica said, once those tests are coming back negative and we have those in our tracking system, we are getting a different number daily.
So just be mindful, even though we do have, approximately 100 individuals on quarantine, they may just be on quarantine for reasons such as travel, not necessarily because they had been
Or
tested.
potential interactions.
Or interaction with a
things of that
positive
nature, Which
case.
it does not guarantee they are infected, but
Correct.
means they could
Yeah.
be, and that goes to the work I think that you've done as far as where we've known we've had a case, all hands on deck to call every single interaction that we can identify
Yeah.
to then help stop the spread, and that's the important work that you guys have been doing for well over a week now.
And that goes to that containment. We know where our folks are, and so we have the capacity, because we have that information, to contain the spread in those areas. And again, as Matt said, this virus is impacting our seniors. And in Montgomery County, when we look at our demographics, we know we have one of the oldest senior populations in New York State. And unfortunately for us, this is hitting our seniors.
One more?
Yep.
What about the 2-week school closing? Will that be extended? Does that have to do with you guys at all?
So no, that's a good question. So one of the things that, this is going back to the weekend in which we announced the state of emergency, as well as the school closing happened later that day. Previous to, that was a Sunday, previous Thursday, Friday, Sarah and I were talking with the school superintendents, giving them the latest information, and we stayed in contact, and there was some pressure coming from the schools to, should we close, should we not close? And at that point, we did not have a case. Well, Saturday, we got the call saying, okay, we had a case, and we reached out, and we immediately mobilized all of our county team and came into the office on that Sunday and started making some hard decisions. And at that point, we decided that we were going to call a state of emergency and that we were going to recommend to the school districts that Sunday that they close and shut down. Later that day, you saw the 3-county region led by the BOCES and Dr. Ziskin, who has been doing a fantastic job coordinating across counties, across school districts, across BOCES, announced that they were going to close. I can't speak for the school districts and say that they are going to extend any further. That's not my call to make. But when you hear that our apex is 14 to 21 days away, and you also, just from basic knowledge from the public health department, that we could be behind that curve a little bit, because really that information is focused around the Tri-County area downstate. And we are going to be behind, so to speak. If our apex is not going to get here for potentially 3 to 4 weeks, I think is likely that you're going to see closures continue. How far they are going to go is, again, to say that you think we know a specific time is just not realistic. What I would recommend to parents, and my wife is a teacher, and so I've been getting a lot of these questions at home as well, and this is what I've said. Prepare for the long haul. If it ends sooner than we think it may, that's fantastic. But we don't see any way in which, certainly the short term, that you're going to see large gatherings of students in schools. However, that is a school district decision that will be made and announced at an appropriate time. But I think I can tell you from all of our talks and everything that's been going on that we need to be prepared for the long haul. Another 3 weeks at least, potentially another 2 months, and worst case scenario, potentially even further than that. But without knowing the specifics, my advice would be make those plans for the long haul. And it's not just the little ones who, even after a few days, are probably driving us all a little crazy, but it's also the seniors. How is, your babci, your grandmother, going to get, the food she needs for the next potential 2 months.
Of her medications.
Or medications, or how her bill's gonna get paid, and things of that nature. So what I would suggest is every family, every group of friends, whatever it may be, that your support system, create a plan. Be prepared. We always say failing to prepare is preparing to fail. So be prepared, get your game plan for the long haul, and hope for the best. Is the best way I could describe that. Morgan, do we have any more questions? No? Okay, so I would like to finish by thanking you two and your team for all your hard work. And if you just got on, I'm just going to repeat where we are at in Montgomery County as of noon today. 4 confirmed cases of COVID-19 and about 100 people in quarantine, which again is different than someone who's self-isolating themselves. It's an important distinction. And we got our first case where there's really not a clear community connection. So we're urging everyone to operate as if it was here, be mindful of our senior citizens, and try to help each other out. We're going to get through this together. We appreciate everybody tuning in. Please share with your neighbors and friends, and be safe.